Let's jump right into this explainer. You know, we use our mouths every single day to talk, to eat, to smile, but we honestly kind of take it for granted. It's far more than just a place to chew your food. It is literally a complex, highly vulnerable gateway to your overall systemic health. Think of it like the front door to your entire biological system. What happens in there absolutely does not stay in there. It echoes throughout your whole body.
To get the full picture, here is our roadmap for today. First, we'll look at the mouth as the gateway to the body. Then, we'll see how the mouth ages. Third, we'll dive into genetics and tooth decay. And finally, we'll tie it all together with connections to overall health.
All right, kicking things off with Section 1, the gateway to the body, understanding the baseline machinery.
Let's begin with something we produce constantly, saliva. And we usually just think of it as, well, water in our mouths, right? But actually, scratch that, saliva is a brilliant multi-purpose solvent. It doesn't just lubricate your food so you can swallow it. It actively kickstarts the digestion process the absolute second food hits your tongue. Beyond that, it acts as an ongoing mucosal cleaning agent that protects delicate tissues and keeps the whole system running smoothly.
So where is all this coming from? You actually have three distinct pairs of glands acting as a 24/7 manufacturing plant. First, you've got the parotid glands. Those are the largest ones, located right inside your cheeks. Next up are the submandibular glands, which are about the size of a walnut and sit right beneath the angle of your jaw. And finally, the little almond-shaped sublingual glands tucked right under your tongue. They all work together in perfect sync.
Moving just behind the mouth into the throat, or pharynx, we find a super rich lymphatic network. This is where your tonsils live, acting as active defense machinery for your immune system. What's really fascinating about tonsils is their life cycle. These masses of lymphoid tissue actually enlarge during childhood while your body is busy learning how to fight off everyday bugs. Then, after puberty, they naturally involute, meaning they just shrink right down.
Moving right along to Section 2, how the mouth ages. We're talking wear, tear, and changing tastes.
Now, here is a truly staggering number, an 80% reduction in taste functioning as we age. 80%. As we get older, the soft tissues in our mouth actually atrophy, and the epithelium thins out, leading to a massive loss of taste buds. Plus, that brilliant saliva we just talked about, production drops, so you have less fluid to dissolve food flavors. To make matters worse, dry mouth is a common side effect of over 250 medications frequently prescribed to older adults. And because the tissue is thinner, it ulcerates easily, drastically increasing the risk for infections.
But aging hits the hard structures too. When someone loses natural teeth, whether from decay or bone resorption, like osteoporosis, it kicks off a painful mechanical domino effect. Literally, just one missing tooth causes the remaining teeth to naturally drift. This creates malocclusion. Basically, your bite stops lining up. That misalignment throws your jaw muscles totally out of whack, producing spasms and chronic headaches, and ultimately puts immense stress on the TMJ, your jaw joint, leading to osteoarthritis and severe pain.
So why does all this matter? Because failing oral machinery directly dictates what you can eat. When you lose your sense of taste and smell, food just isn't as appealing. Throw in missing teeth and trouble chewing, and people naturally shift their diets. They start avoiding meat and crunchy vegetables and lean heavily towards soft, high-carbohydrate foods. That direct line from a failing mouth straight to a high-carb, low-protein diet leads to profound nutritional deficits.
All right, Section 3, genetics and tooth decay. Let's look at nature, nurture, and the risks involved.
Believe it or not, your oral health storyline actually starts before you're even born. If embryologic growth gets interrupted between the 4th and 10th weeks of gestation, craniofacial differences can occur, and the clinical data highlights some very distinct demographic variations for things like cleft lip and palate. In the general U.S., it happens in about 1 in 940 births, but that rate jumps to 1 in 500 for Asian and Native American populations and drops to 1 in 2,500 for those of African heritage. There's also a big sex difference. Males are twice as likely as females to be born with a cleft lip.
Looking at environmental impacts early in life, the numbers are honestly a bit shocking. Dental caries, which is just the clinical term for tooth decay, is the most common chronic disease in children. A massive 42% of U.S. kids between the ages of 2 and 11 already have decay in their primary teeth. This happens when natural mouth bacteria throw a party with carbohydrates from things like juice and snacks. They produce an acid that literally demineralizes and softens the tooth enamel.
And we really have to note that these oral health disparities are deeply uneven. Tooth decay disproportionately impacts Latino and Black children, lower-income families,
rural residents, and unhoused populations. Why is this so crucial to understand? Because persistent, unaddressed tooth decay establishes a baseline of chronic inflammation in the body, and that early chronic inflammation is directly linked to massive downstream issues later in life, like coronary artery disease and metabolic syndrome.
And that brings us to our final part, Section 4, Connections to Overall Health, the Systemic Threats.
Here is another wild stat: 42%. It turns out that 42% of U.S. adults older than 30 suffer from periodontal disease. That is a huge chunk of the population. Now, this isn't just a simple cavity. We are talking about a persistent pathogenic bacterial inflammation of the gums and the alveolar bone, the actual bone holding your teeth in place. It's driven by poor hygiene, poor nutrition, and smoking. But here's the kicker. This inflammation doesn't just stay in your mouth. It is heavily connected to severe systemic conditions, including obesity, diabetes, and cardiovascular disease.
There's also a massive medical shift happening right now with oral and pharyngeal cancers. For about 30 years, cancer rates were actually dropping, thanks to a huge decline in smoking and tobacco use. But suddenly, the numbers are creeping back up. The emerging cause? Infection with human papillomavirus, or HPV. These cancers are now showing up in much younger adults, predominantly men. The good news here is that the HPV vaccine offers highly effective protection against the specific strain driving this increase, which makes patient education absolutely crucial right now.
Finally, let's look just behind the mouth at the airway. When anatomical structures in the upper airway partially or completely collapse for just 10 seconds during sleep, it causes obstructive sleep apnea, or OSA. This cuts down airflow and actively drops your blood oxygen levels. The prevalence is huge, affecting roughly 34% of men and 17% of women in the US, and it's climbing right alongside obesity rates. This isn't just a snoring issue. This anatomical collapse heavily increases your risk for major cardiovascular and metabolic diseases.
Well, we've covered a ton of ground in this explainer. Knowing all of this, from the brilliant chemistry of your saliva to the mechanical domino effect of a single missing tooth to the severe systemic threats of gum disease and sleep apnea, it really changes how you look at your mouth, doesn't it? It's not an isolated cave, it's the vital, vulnerable gateway to your entire well-being. So I'll leave you with this to think about. What warning signs might your own gateway to health be giving you right now? Take a second, listen to your body, and whatever you do, don't ignore what your mouth is trying to tell you.